Assalamu alaikum. This article talks about the incidence of altered sensation after mandibular premolar and molar periapical surgery. This is a study done by Anshul Mainkar and Karman Safavi in Journal of Endodontics in 2020. The dysesthesia and paresthesia are abnormal sensations that can be spontaneous or provoked. The two terms differ. So the dysesthesia is reserved for sensations that are unpleasant, where the paresthesia is like a pins and needle sensation, where anesthesia is a loss of sensation. The reports on altered sensation after periapical surgery are rare, and hard data are lacking. So currently there is a limited information available on incidence of paresthesia after a specific endodontic procedure, and in particular periapical surgery. So the objective of this study was to determine the incidence of altered sensation after periapical surgery procedure on mandibular premolars and molars. This retrospective study included all patients who received a periapical surgery procedure on mandibular premolars and molars at University Hospital in endodontic clinics. The inclusion criteria were a mandibular premolar and molar apicectomies of 78 teeth between July 2013 and December 2017, and the minimum follow-up period is the patient come back for suture removal. And we can see in this table about the reason for exclusion, which is root intersection, but there is no root infilling and total root resection, inadequate record for the patient, and inability for follow-up and absence of the patient follow-up. And the presence of altered sensation was defined as the patient reporting any change in sensation after local anesthesia dissipated at the time that the patient returned for his or her first follow-up visit. In most cases, this coincided with the suture removal appointment. If there is no mention for altered sensation in the patient record, was assumed that the patient had no altered sensation, and most of all the surgery performed in modern endodontic surgery using operating microscope, and also the patients were informed about the possibility of altered sensation and advised to contact the clinic in case of untoward events, and the patient retained for suture removal in 3 to 7 days post-operative. In the result, from a total of 78 teeth, 63 teeth were included in the analysis, and the teeth included in this analysis were 13 premolars and 50 molars. The overall presence of altered sensation at follow-up visit was 14%, 9 teeth of 63 teeth, and the average time until the first follow-up was 6.1 days, and with the range 3 to 37 days. And this table we find the description of 9 cases of altered sensation, and a premolar had a significantly higher odd ratio of incidence of altered sensation than the molar, with the odd ratio 7.19. The absence of altered sensations even after periapical surgery is relatively rare in mandibular molar surgeries, but considerable risk in mandibular premolar surgeries. It is reasonable to expect a higher incidence of altered sensation in premolar cases than molar cases because of the location of the mental foramen. The absence of a significant difference between different variables in this study may be because of the small sample size. In conclusion, the incidence of altered sensation after periapical surgery appeared to be relatively high, 14%, with the higher incidence found in premolars compared with the molars. And patients should be advised about the possibility of altered sensation after periapical surgery procedure. And thank you.